Modern life is full of stress and worries. The competitive world has given us a challenging life, and many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma, a spiritual healer from the city of the Golden Temple. His graduation from Sri Lakshmi Narayan Ayurvedic College, one of the oldest institute in our country, associate with Sri Durgyana Education Foundation. His masters from the University of Madras. His PhD in the role of Ayurvedic herbs in psychological disorders. Listed in the World Book of Records for promoting Ayurveda and developing a chain of Ayurvedic treatment and Panch Karma centers in various parts of the globe.
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
लंदन में इंडो यूके लीडरशिप समिट का आयोजन, आयुर्वेद को लेकर जागरूकता पर जोर, द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने लोगों को किया सम्मानित।
Commendable Global Recognition Award was received by Dr. Navdeep Sharma and Dr. Monica Sharma on behalf of ND Care Nirogam Private Limited for leading Ayurvedic services at the British Parliament, UK.
ब्रिटेन में बजा भारत का डंका, नवदीप शर्मा और डॉक्टर मोनिका शर्मा को मिला आउटस्टैंडिंग कंट्रीब्यूशन टू आयुर्वेदिक हेल्थ सर्विस पुरस्कार।
Dr. Navdeep Sharma has also been awarded the title of Pranacharya by the Akhil Bharatiya Ayurveda Mahasammellan.
आयुर्वेदिक डॉक्टर नवदीप शर्मा को युवा प्राणाचार्य की उपाधि दी गई। भारतीय आयुर्वेद महासम्मेलन में सम्मानित किया गया। कार्यक्रम में मनोज तिवारी मौजूद।
नमस्कार सर, अ वेरी वार्म वेलकम इन टुडेज लाइव सेशन।
नमस्कार जी, और सारे व्यूअर्स को हम दोनों की तरफ से नमस्कार।
राइट सर, एंड a very good evening to all dear parents. So today I really wanted to have interaction live session with Dr. Navdeep sir, and जहाँ पर सर की बहुत ही golden opportunity जो हम आज लेने जा रहे हैं, and having interaction with one of the most globally renowned autism specialist, Dr. Navdeep sir. So sir, I would like to take the queries of those all parents, and so that
Definitely, Rajat. We always believe in the questions. First of all, your queries are really very important for us, and I can always understand that waiting for the Wednesdays to ensure that all your questions are taken by us is something which is really very important. That is why there are multiple things to discuss with you, but before I discuss things with you further, I would definitely be moving ahead with the queries which Rajat will be asking on your behalf from me. So Rajat, you can carry on with the queries.
right, sir. So, sir, for the very first question from Alka Kumari ji, silver member, and they have mentioned that my son, how much time it will take to have a proper speech, and so the details are from Navneet. Treatment started on 23rd of August, and Mohali OPD, and the name of the child is Ame Kumar, age 3 years and 2 months. Father name is Neeraj, location is from Bihar, and the medicines are there 10 ml in the morning Brainovar, 10 ml in the afternoon, and 15 ml in the night. So the cucurbit oil is 8 drops twice a day. Mukta pastry is 125 mg only one times. And so far 4 sessions are going on with Anjali ji. So these are the details.
And it is Ame.
Ame. Right.
So in case of Ame, since the age is 3.2 years, as Rajat just mentioned, now for a child who is below 4.5 years, if the parents can do the therapies diligently, it generally takes from 1 year to 1.5 years, not more than that. So do more ABA sessions over here in Ame's case, because below 4.5 years of age, a child is at a highly receptive age for language development, for learning new skills, because that is a reflex learning age for the child. So it should not take 1 to 1.5 years. That should be the maximum time. But as I just mentioned, the number of ABA sessions need to be very regular. If you feel you can do it properly at your own place, carry it over there. There are cases where the parents will say that, see, the psychologist is telling us, but it is tough for us to do the thing. So if that is the case where you find it tougher for your own self to be doing those things because of your busy curriculum or the child being too uncooperative, don't waste a single day. You have all the options. You have the option of our autism specialized Chandigarh Panchkarma Center where you can stay in house. It is a NABH certified facility, so it is claimable with all major insurance companies. And if you feel that there are financial constraints, our Amritsar Charitable Center is there to welcome you, where you definitely cannot stay inside, but you can stay somewhere outside. And people in the holy city of Amritsar, they prefer staying in the vicinity of the Golden Temple, where they can daily go for darshans and they come to us for all the therapies and all that things which we are doing. So that is something which needs to be done if you feel that at your own home you are finding it difficult to do the things. But having said that, in MS case, if everything is followed, 1 to 1.5 years. Yeah.
Thank you, sir. And sir, in context to this, the another question which has guided by Ms. Ashima as a coordinator, and the name of the mother is Risha Purwar, and she has joined as a silver membership, and she has mentioned that, hello sir, my patient code is 522704. I want to know about how can I control his stimming, and my son is special attachment with educational things. He doesn't want to play with the cars and the toys. And so basically, sir, parents are Indian, but they are staying at Vietnam, taking treatments in September 3rd, 2025. Online treatment started, and Breno are concentrated 10 ml in the morning and the night time 10 ml. Mukta Pishti one time 125 ml.
Again, repeat the medicines, Rajat.
Yes, sir. Breno are 10 ml in the morning and 10 ml in the night time.
Age of the child is
2 years and 11 months. Right. And 9 ABS sessions done so far with Dr. Gurpriya ma'am. And the words of Dr. Gurpriya are improvements in the terms of school teacher giving the good feedbacks, sitting tolerance is enhanced and getting better gradually. But still the concerns are their limited speech, stimming behavior, and excessive interest in educational items such as alphabets, numbers, and books. Shows little interest in toys and other play
name of the
activities.
child is
Avik.
Avik.
Yes.
So, in case of Avik, you are from Vietnam. Vietnam is a nice place. Last year I had been to Phuoc. That was really a nice place. And coming to the child being more associated with numbers. Now, what I would like to tell you over there is that, see, when we talk about autism, it is not only a disease where the intellectual capabilities will be less or the concentration span will be less. Many a times, autism is also a disease where you will see that the child is over intelligent, more intelligent than his age, or in cases where child may have a greater interest in alphabets, academics and all. So don't worry about that. The stimming behavior is definitely going to come down. And as we use more and more ABA and the herbs which we have guided, you will see him mingling up. We need to work on the socialization though on direct basis. Try it yourself if required. Plan a visit to India. But initially, after around 20-25 sessions of ABA, Gurpriya will start working on that part also. So don't worry. And before we go for the next question, we are about to take a very small break, not a long break, because I need to analyze the reports being shared by you. So taking a small break, stay with us.
Autism is a temporary phase in the life of a child if treated timely.
थैंक यू सो मच नवदीप शर्मा जी, थैंक यू सो मच। आपने मेरे बच्चे को ऑलमोस्ट ठीक किया। हमने तो उम्मीद ही छोड़ दी की थी कि मेरा बच्चा कभी ठीक भी हो पाएगा।
मैं एक्सपीरियंस बताना चाहूँ तो वो मतलब मैंने बच्चे में ड्रास्टिक चेंज देखा है। रिकवरी पकड़ी है, चोट वो नजर ना लगे, वो बहुत अच्छी, मतलब वो ड्रास्टिक चेंज है वो।
I have seen immense change in my son. लाइक जब हम यहाँ पे आए थे तो ही वॉज लाइक वो एक एक वर्ड ही बोलता था। एंड जब से हमने मेडिसिन शुरू की है, एंड मेडिसिन के साथ साथ शिरोधारा भी इसकी मोर देन 1 ईयर से चल रही है, एंड विद कंटिन्यूटी ऑफ दिस मेडिसिन एंड ऑल उसमें ड्रास्टिक चेंज है।
यहाँ मेरे बच्चे में इतने दिनों में हाइपर एक्टिविटी कम हुई है, उसमें इम्प्रूवमेंट है, बर्ड्स में क्लियरिटी आई है।
उसका पंचकर्मा हुआ तभी उसमें जो हाइपर एक्टिविटी था उसमें हमें बहुत फर्क नजर आया, और उसकी स्पेशली जो स्लीपिंग साइकिल थी वो उसकी एकदम से सेट हो गई।
Autism is a temporary phase in the life of a child if treated timely. Autism is a temporary phase in the life of a child if treated timely.
थैंक यू सो मच नवदीप शर्मा जी, थैंक यू सो मच। आपने मेरे बच्चे को ऑलमोस्ट ठीक किया, हमने तो उम्मीद ही छोड़ दी की थी कि मेरा बच्चा कभी ठीक भी हो पाएगा।
मैं एक्सपीरियंस बताना चाहूँ तो वो मतलब मैंने बच्चे में ड्रास्टिक चेंज देखा है रिकवरी।
Welcome back, and that was a small case study for you. We keep on sharing our case studies because when the people say that autism is something which a child cannot come out of it, and when Google says that, and when the world says that, the biggest challenge at that time which we face is that many a times the people when they start with us, the parents when they start with us, they started half-heartedly. As a result of that, in the beginning itself, maybe for a month or 2 months, when they are already apprehensive about Ayurveda and whether the child will come out of it, they drop the treatment. But believe me, anyone who stays with us for 3 months or longer always stays with us and improves. And that is why I always do treatment in a phase of six months. That is the basic reason, so that we can see ample improvements also. And at the same time, while we are watching ample improvements over there, the parents can also see substantial recovery coming the way of the child. Yes, Rajat, go with the next question.
Yes, sir. So now we have the third question, Mayur Naik, our silver member, and he has mentioned, sir, hi, sir, my daughter Tuisha, throwing things, smashes, hand on bed, kindly guide, sir. So the details I have got from Navneet, is a coordinator, and she has mentioned that treatment has started from 24th of August 2025 from Mohali OPD, and age of the child is 3 years and 10 months. Father name is Mr. Mayur Balkrishan Naik ji from Goa, and the herbs are, sir, Brainovat 10 ml in the morning and 10 ml afternoon and 10 ml in the night time. Mukta paste is 0.62.5 mg, and cucurbit oil is 8 drops in the morning and 8 drops in the night time. Saraswata Rishtam with gold is 2.5 ml. Brihat Vad Chintamani Ras 0.10, and the sessions are going on with Rahul sir. That is the thing. That's only it is, sir.
So as of now, you need to stop the Saraswata system with gold, because although it is good for your child, but at times Saraswata system with gold can cause a bit of restlessness. So as we are facing a bit of restlessness, it's better to stop Saraswata system with gold for some time, and then later on at some stage we definitely can start with it. And along with that, I don't know the number of sessions which are being done, at least 2 sessions to 3 sessions in the beginning to settle the child out. So that is
Thank
the
you,
thing
sir.
which is required. And if you feel the restlessness is too much, as I always request, it's the beginning phase of your treatment. You started it recently. Don't get demotivated. At any stage you feel the slightest of demotivation, come to us. We'll do that for you. But don't be demotivated. If you can keep yourself motivated, if you can support by carrying out everything which you are guiding for at least next 2 to 3 months, you will see all the stimming and everything going down. Don't worry. Yeah.
Yes. Thanks a lot, sir. Sir, in context to this, I have one patient, sir, from Australia, and they have taken the treatment. It's been around 2 years. And the mother, she has mentioned that, sir, what are the role of herbs, as we are getting the many much recovery from psychotherapy session, and now they are in doubtful that what are the role of herbs, sir. Sir, I need you to guide to those parents, sir.
So that is a very interesting question. What happens is that is the biggest problem which we face. There are people who will say, what is the role of psychotherapy? When we initially guide them that, see, these are the herbs. Now these herbs need to be supplemented by our self-developed ABA curriculum. That is very important to understand. Self-developed ABA curriculum. So they say we are already taking so much of psychotherapy near to our home. And many a times in the beginning part of the treatment, maybe for 6 months, for first 1 year, we face a lot of problem with the parents at times, that they will say, yes, give us the herbs, let us do the psychotherapy from our nearby center. And by the time a child recovers by 50-60%, and we are in the second year, this is the common thing which happens. All of a sudden, when the child crosses that 60%, 70% improvement, the parents start feeling, is the herb really required? Because by that time, the child is also very comfortable with the psychologist, and that is why the parents feel that way. But the problem over here is the herbs are being given so that the psychotherapy is possible. If you withdraw those herbs, the kind of ABA which we are utilizing, which we are following for the children, cannot be accomplished. Now that is the problem. And if we only give herbs, we don't do the ABA, it is only half the benefit. So that is the beauty of our treatment. That is what I did in my research. And for all of you, just in few days, I have already completed my book on autism. It will be an international publication. Recently, I have also shared one of my research paper in few international journals on autism, because what I am trying to do by publishing everything for the international community, so that everyone, the allopathic doctors, the psychologists, they know how it is being done, because I want maximum and maximum children coming out of it. And hopefully within next 1 month, the book which I am telling you on autism, that is going to come, and that is really going to help everyone in understanding how, why, what, when to take, what to take, when to wean off. A lot of questions will be answered by that book also, hopefully. Yes.
Thank you, sir. Thank you for information, sir. And now, sir, we have having the fourth parent, Ritakshi Sharma. They are silver membership. Good evening, sir. Patient name is Satvik, 2.9 years old, and diagnosed with nephrotic syndrome since March 2025. Coordinator name is Neha, and she has mentioned that is it safe to give cow milk to a baby, and how much quantity daily?
What is the age of the child?
Sir, 2.9 years.
Yeah, you can give cow milk to your child in nephrotic syndrome. There is no harm in that. It's only the herbs or food which are heating in potency which should not be given to the child. So giving cow milk to him should be absolutely safe. There is no problem about that. If you can put some green cardamom, hari elaichi in that, and a bit of saunf in that, that will even make it better for your child. That is very good for nephrotic syndrome. Yes.
Thank you, sir. So we have the fifth question. The patient, they want in Hindi, sir. And there's sir,
I'll be coming to your fifth question once again. All that I need is a small break, because there are few reports once again to be analyzed. Stay there with us and just give us few moments. Let me go through a few videos so that I can be in a better position to answer your question. Stay with us.
Autism is a temporary phase in the life of a child if treated timely.
ਪੰਚਕਰਮਾ ਕਰਵਾਇਆ, ਮੈਨੂੰ ਸਾਰੀਆਂ ਥੈਰੇਪੀਜ਼ ਪੋਜ਼ਿਟਿਵ ਲੱਗੀਆਂ। ਮੇਰੇ ਬੱਚੇ ਵਿੱਚ ਡੈਫੀਨੇਟਲੀ ਇੰਪਰੂਵਮੈਂਟ है।
हमारी प्राजवी की ट्रीटमेंट यहाँ पे अभी चल रही है आयुर्वेदा में, और हमें अच्छा लग रहा है कि प्राजवी में जो इम्प्रूवमेंट है वो अच्छी खासी हुई है।
हमारे बच्चे में बहुत इम्प्रूवमेंट हुई है। उसमें काफ़ी बिहेवियर में भी काफ़ी चेंज हुआ। अभी वो अग्रेसिव भी नहीं है और स्पीच भी बढ़ी है उसकी।
That one thing I can say for sure, that my son's sleep routine is pretty much better than before.
सर से मिले हुए बच्चे का ट्रीटमेंट मेरा चल रहा है।
So well, dear parents, now I would like to guide you like you have to join as a platinum member. You can be joined for that, in which you can have the facility to have the direct word with Dr. Navdeep sir, in which you will get a doctor for the history taking part, and as a psychologist for the compilation of the behavioral challenges of the child, and then your concern will be directly answered by the Dr. Navdeep sir. So I want you to be all viewers to become a.
I would like to brief up
Right,
what
sir.
Rajat is telling in a better way for you. What happens is that, see, when we are discussing things over here in the live sessions, I definitely am always there to help you out on all your questions. They're really very important for me. But what happens is you all join with a lot of hope, and I always want to live up to that hope. In a span of 1 or 2 minutes at times, just analyzing a thing and answering something to you becomes tough if you are joining us for the first time. For all of you who are our patients, whose compiled history is there with us, whose videos are there with us, whose details are there with us, you could see Rajat is telling me what the coordinator is telling about that case. So that helps me in analyzing the case in a complete way. But for anyone who is new, we need a thorough psychotherapeutic evaluation for the child to understand exactly, is it autism, is it ADHD, is it learning disability, or is it nothing, only speech delay. There are a lot of things to be analyzed. And if it is autism, is it mild, moderate, severe? And if it is in any category, what are the expectations of the parent and what are the problems currently faced by the parents. Not all that is analyzed by a psychologist through some videos, through some video conferencing sessions, and then an Ayurvedic doctor who is expert to take the history to understand whether it is autism without an associated brain damage, delayed cry, ischemic insult, MRI changes, EEG, or is it a autism with an associated problem like this? Then what is the treatment history? What all has been done? What were the improvements that the child had, or whether the child is going towards a downhill track? There are lot many things to be analyzed. Now all that analysis is practically impossible to be had from a single question. So that is what Rajat is trying to guide you about, that how it's possible to get everything analyzed, everything evaluated, so that when your question comes to me, I have entire details of the case, and then I can be in a better position to answer you those things. So basically, he's trying to help me out by guiding me in that regards. So yes, Rajat, please go ahead with the next question.
या थैंक यू सर. सर नेक्स्ट व्यूअर है सर, हिंदी में सर आंसर चाहते हैं सर आपसे. सर डिटेल्स हैं फ्रॉम कोऑर्डिनेटर नकुल, एंड पेशेंट का नाम बताया गया है श्रेयांश, एज है 4 साल 3 महीने, फ्रॉम बेसिकली फ्रॉम वेस्ट बंगाल कोलकाता. मदर ने कहा है कि सन इज़ टेकिंग मेडिसिन, वो डेली लेते हैं, डाइट फॉलो, बट अभी मेडिसिन कितनी देर तक लेनी पड़ेगी, अभी तक कुछ रिजल्ट नहीं आ पा रहा है, अभी 1 मंथ ही हुआ है. तो मेडिसिन सर चल रही हैं 5 ml इन द मॉर्निंग ब्रेनोवार एंड 5 ml इन द इवनिंग. कुकुरबिटॉल चल रहे हैं 5 ड्रॉप्स इन द मॉर्निंग एंड 5 ड्रॉप्स इन द इवनिंग. जी सर.
ABA सेशंस कितने?
नो सर, सर ABA देयर इज नो ABA.
देखिए बहुत जरूरी है मैम, मेरा इलाज भले ही आप ऑनलाइन किसी कोऑर्डिनेटर के थ्रू करा रहे हैं, लेकिन बिना ABA के इलाज काम करने के चांसेस बहुत कम हैं और बहुत अधिक समय लग जाएगा. नाम क्या बताया आपने?
सर बेटे का नाम है श्रेयांश एंड मदर का नाम है पिंकी शाह.
तो श्रेयांश के केस में मैम, अगर आप वाकई चाहती हैं कि हम आपकी उम्मीदों पे खरे उतर पाएं, हालांकि दवाइयों की डोज कम है, लेकिन मैं उसके बिना काम चला सकता हूँ, इतनी डोज से भी काम चला सकता हूँ. ABA सेशंस में मत मिस करिए बिल्कुल भी. इमीडिएटली अपने कोऑर्डिनेटर से बात करें, ABA स्टार्ट करें. वो साथ में होगा तो 3rd मंथ से आपको कुछ कुछ बदलाव आने शुरू हो जाएंगे. जिस दिन ABA स्टार्ट करेंगे हमारे वाली इन हर्ब्स के साथ, 3rd मंथ उसके बाद गिनिएगा आप, मतलब अब से 4 महीने. अभी 1st मंथ आपने इलाज करवाया है, आपको रिजल्ट जरूर आएंगे. ABA प्लीज आप मिस मत करिए जी.
Thank you, sir. Sir, the next details received from coordinator Nakul and patient want in Hindi, sir. उसी के साथ सर बेटे का नाम है दिव्यांश, एज है 9 years and 1 month, मदर का नाम है रितु जी, फ्रॉम दिल्ली. अकॉर्डिंग टू द मदर ने कहा कि सन इज टेकिंग द मेडिसिन ऑन डेली बेसिस, एवरीथिंग इज फाइन. मैंने दिव्यांश की मेडिसिन स्टार्ट की हैं. मेडिसिन देने के बाद दिव्यांश को कॉन्स्टिपेशन की प्रॉब्लम सर आ रही है, नींद नहीं आती थी, बट अब नींद में इम्प्रूवमेंट है. डोसेजेस चल रही हैं ब्रेनोवार के सर 5 ml इन द मॉर्निंग एंड 5 ml इन द नाइट टाइम. ABA सेशंस गाइडेड, बट CP नेक्स्ट मंथ से स्टार्ट करूंगी सर, ये कहा गया है. सो प्लीज सर गाइड सर.
एक तो आप केवल अभी ब्रेनो आर ले रही हैं, अगर साथ में कॉन्स्टिपेशन रह रही है, 9 इयर्स की एज है, नाइट में बबूना जरूर ऐड करिए. बबूना सिरप अगर आप लेते हैं तो डेफिनेटली आप जो है देखेंगे कि कॉन्स्टिपेशन के अंदर वो लाभ पहुंचाएगा, वो नाइट में आप ले सकते हैं. और इसके साथ साथ जैसा कि मैंने आपसे पहले वाले क्वेश्चन पे बताया, ABA सेशंस हरगिज मत करिए. ABA सेशंस अगर आप मिस कर देते हैं तो वो बात नहीं बन पाती है. फर्क कुछ ना कुछ दवाइयां तो डालेंगे, लेकिन आप केवल कुछ ना कुछ फर्क के लिए थोड़ा ना हमारे पास आ रहे हैं. इतने डॉक्टर्स हैं, इतने साइकोलॉजिस्ट हैं. अगर आप एक उम्मीद के साथ हमारे पास इलाज के लिए आए हैं तो हमें आपकी उम्मीद पर खरा उतरने के लिए प्लीज आप सहयोग जरूर करें जी.
राइट सर. सर नाउ द 7th query from Priya Chaudhary ji, silver membership they have joined, and मुक्ता पिष्टी ब्रेनो आर और पंजीरी और साथ में ABA चल रहा है, लेकिन बात अभी भी नहीं कर रहा. पार्क जाने पर स्विंग ही बस करना चाहता है और आजकल बहुत रोता भी है. So these are only the details, but the not proper details received from the coordinator side. So the question is from the parent side, sir.
मैं माफी चाहूंगा, आपके कोऑर्डिनेटर को मैं चेंज कर रहा हूँ. क्योंकि आपके कोऑर्डिनेटर आपकी मदद के लिए अवेलेबल नहीं है। आप प्लीज़ अपने कोऑर्डिनेटर का नाम हमें लिख सकती हैं। नेक्स्ट लाइव सेशन में हम आपका कोऑर्डिनेटर चेंज कर देंगे, ताकि आपको एक ऐसे कोऑर्डिनेटर को हम एलोकेट करें जो आपकी प्रॉब्लम्स हम तक पहुंचा पाए। क्योंकि मेरे लिए जानना बड़ा ज़रूरी है कि एबीए सेशंस कितने चल रहे हैं, और इसके साथ साथ नकुल को ही मैं आपके कोऑर्डिनेटर के फॉर्म में दे रहा हूँ। जैसा कि आपने देखा, नकुल अपने पेशेंट्स को पूरी सपोर्ट भी कर रहा है, तो आपका कोऑर्डिनेटर नकुल रहेगा। नकुल, अगर आप मेरी बात सुन रहे हो तो प्लीज़ आप पेरेंट्स को रीच आउट करके एबीए सेशंस की डिटेल्स दीजिए। क्या है, एबीए सेशंस कितने हो चुके हैं, किसके अंडर हो चुके हैं, कितनी देर से इलाज हो रहा है। मैडम, बड़ी सारी डिटेल्स मुझे चाहिए होंगी, फिर मैं आपको सही चीज़ बता पाऊंगा। आपका सवाल मेरे लिए बड़ा इंपॉर्टेंट है। और पंजीरी दवाई का कोई हिस्सा नहीं है। आपने मेंशन किया कि आप पंजीरी भी दे रहे हैं, तो मुझे नहीं पता आप कौन सी पंजीरी दे रहे हैं, लेकिन ऐसी कोई दवाई नहीं है पंजीरी जो हमारे ट्रीटमेंट का हिस्सा हो। ट्रीटमेंट में और बहुत सी मेडिसिन हो सकती हैं। 2 मेडिसिन का नाम आपने लिखा है, तो मुझे फर्दर डिटेल्स आपके एंड से चाहिए होंगी। जी रजत।
Right. Thank you, sir. And sir, now the next query from Motivated Soul, silver member. The parents are there. Sir, hi, sir. We are having treatment for our son. He is getting better gradually. Sir, we would like to know, can we perform Shirobasti and Shirodhara at home itself? Thank you so much in advance, sir.
I would have loved to say yes to that. But the thing is that you can do Shiro Pichu at home, but Shiro Basti and Shiro Dhara are very technical kind of things. At least in 70 to 80% of Panchkarma centers around the globe, Shiro Dhara is done in the wrong way. They pour oil over here, it is to be poured over here. They do it in any way. It has to be decided as per the condition of the child whether it has to be clockwise or anti-clockwise. So those things have to be decided. So I would say that don't do it at home. If required, spare out some time. Let us do that. There are things which can be done at home. Shiropichu can be done. Then psychotherapy. Yes, you can do that psychotherapy at home. Carry those things under our trainings, but avoid Shirovasti or Shirodhara. For that, we would like to welcome you over there at one of our centers whenever it's possible for you. Yes.
Right. Thank you, sir. So the next query from the parents, Sandeep Satyanarayan ji. He is our silver member, sir. And the medicines they are giving, Breno R plus 15 in the morning, 10 ml in the night time, and 10 ml in the afternoon time. Cucurbita oil, 8 drops thrice a day. Mukta Pishti, 0.250 mg. All three we are providing. ABA session will be taking to Rahul. Sir, he is having behavior issues and sensory issues.
Any details from the
Sir, no, sir,
coordinator?
there is no detail from the coordinator.
Name is?
Sandeep Satyanarayan ji.
Sandeep ji, I am changing your coordinator also. I am allocating your case to Dr. Ruchi. So Dr. Ruchi will be your next coordinator, because it's very important for us to understand further certain details, like if we say there are behavior problems, what kind of behavior problems? We need to be very particular about that. And again, a very common question which I always ask from the parents: the number of ABA sessions. Yes, you have mentioned that the ABA sessions are going on through Rahul. How many sessions till now? And since how long you are taking the treatment? And what is the frequency of the sessions? The medicines which you are taking are not at all wrong. And rather, we don't require cucurbita oil all 3 times a day. It has been mentioned you are taking cucurbita oil 3 times a day. It's only required 2 times a day. We don't require it 3 times a day. So share some details, and otherwise, once your coordinator is changed to Dr. Ruchi, I hope you will be getting a better support from our end also. Yeah.
Right. Thank you, sir. So now the next details received from Harshit Jain ji. He's our silver member, and Tarun is our coordinator, and Sahaj Jain is the name of the child. And सर बेटे को स्टार्ट कराया है मई 2025 से ब्रेनोवार 15 ml सुबह और 15 ml नाइट शाम में दे रहे हैं. कुकर बिटा दे रहा हूँ 8 ड्रॉप्स इन द मॉर्निंग एंड 8 ड्रॉप्स इन द नाइट टाइम. अब कितना टाइम और देना पड़ेगा सर, कृपया बताएं.
हर्षित जी, सवाल फिर से वही है, कब से दे रहे हैं प्लीज बताएं, बच्चे की उम्र क्या है प्लीज बताएं, प्रॉब्लम्स कितनी आ रही हैं बताएं. सो मेरे सवाल आपसे ज़्यादा हैं आपके सवालों से. सो डिटेल्स आएंगी, मैं डेफिनेटली आपको बता पाऊंगा. मेरा अपना ये मानना है, अंदाजे से कुछ नहीं बताना है. कभी भी मैं किसी भी पेशेंट में अगर कुछ भी कमिटमेंट देता हूँ, उस मालिक को ध्यान में रख के, तो मालिक मेरी राज रखते हैं और कमिटेड टाइम फ्रेम से पहले हम रिजल्ट्स देते हैं. सो आपको कुछ भी बताने से पहले मुझे बहुत सी चीज़ों की जानकारी चाहिए होगी. बाकी मैं ये भी नहीं जानता हूँ आप मुझे अभी तक मिले हैं कि नहीं मिले हैं, क्योंकि जब मैं इंडिया में हूँ, जहाँ पॉसिबिलिटी बनती है मिलिए ज़रूर. मिलकर के जो बात हो जाती है, एनालिसिस के साथ जो बात हो जाती है, ऑनलाइन होता है और एनालाइज होता है। सो इसीलिए मैं अभी भी भारत में हूँ। मेरी 2 अपकमिंग ओपीडीज रहेंगी इंडिया के अंदर, इससे पहले कि मैं अपनी इंटरनेशनल ओपीडीज की तरफ प्रोसीड कर जाऊँ। एक जो अपकमिंग चंडीगढ़ ओपीडी है और उसके बाद एक जो चैरिटेबल ओपीडी रहेगी अमृतसर सेंटर की, समवेयर अराउंड 8 to 10, 8 से 10 तारीख के बीच में होगा। उसके बाद शायद इस ईयर के अंदर हम नहीं ओपीडीज रख पाए और नए साल के बाद ही ओपीडीज हो पाए, क्योंकि उसके बाद बैक टू बैक हमारे कुछ इंटरनेशनल करिकुलम जो हैं वो मिस चल रहे हैं। सो मेरी रिक्वेस्ट रहेगी उन सभी पेरेंट्स से, उन सभी पेशेंट से जिनको 6 मंथ्स मिले हुए हो गए हैं, जो पेरेंट्स हैं इनमें से किसी एक ओपीडी का फ़ायदा उठा सकते हैं, या जो पहली दफ़ा मिलना चाहते हैं। ऑनलाइन इलाज आपने शुरू किया हुआ है, टीम के साथ चेक कर लीजिए, अगर कोई स्लॉट बन पाता है तो ज़रूर मिले, क्योंकि मिलकर के एनालिसिस करके एक अलग ही लेवल की इम्प्रूवमेंट जो है वो आ पाती है। जी,
थैंक यू सर।
सो इसी के साथ मैं डॉक्टर नवदीप शर्मा और आज रजत मेरे साथ है, हम दोनों ही आपसे आगे चाहेंगे। हमारे साथ जुड़ने के लिए बहुत बहुत धन्यवाद। हमारे वीडियोस को आपके लाइक्स, आपके शेयर्स ज़रूर मिलते रहें, वो आपसे एक्सपेक्टेशन रहेगी, हमारे लिए वो मोटिवेटिंग रहते हैं। नमस्कार।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
Hello?
आ जाएगा वो।
कलर करो, वेरी गुड पार्ट, कलर करो। नो, इस हैंड से करो, वेरी गुड। इसके अंदर रख दो, वेरी गुड। पापा ना हैंड नीचे का हैंड करो, वेरी गुड, खाओ, वेरी गुड।
Hello parents, Parth, say hello, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July we went to Dr. Navdeep Sharma sir, as sir had told me about him. We never imagined that in just 9 months Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today Parth says mama, papa and everything else with understanding. By God's grace and with sir's medicine and guidance, in just 9 months Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, Sir. Thank you very much for bringing such great happiness into our lives. Thank you, Indian Rogam.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Vitika, age 20 years old, disease autism. Chief complaints: hyperactivity, behavioral issues, shouting and screaming, irritation.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on 23rd January 2023 at 3:00 p.m. and felt the scope of treatment to work for the child. Before the treatment, the chief complaints were regarding hyperactivity, shouting and behavioral issues. She screamed abruptly and showed irritative behavior frequently. With the ongoing treatment, significant improvement was there in her condition. Hyperactivity was reduced a lot. She also became more calm and also stopped shouting. Along with that, irritative behavior also showed improvement. She also got involved in co-curricular activities like sketching and painting, which improved her performance. She also showed a lot of growth in terms of expressing herself. She started singing and other activities.
I am Ranjit Sen. My daughter's name is Ritika Sen. She is an autistic patient. Approximately a year ago, I found Dr. Namin Sharma through a Google search, saw his professional website, and after that we promptly contacted him. Since the beginning of January 2023, we have consistently been taking the prescribed medicine. Under the supervision of Dr. Namindu Sharma, in 9 months, we have seen a lot of improvement from this medicine. In the beginning, my child used to scream. She would suddenly scream all the time. She was irritable all the time. She was hyperactive. She was extremely hyperactive. After taking the medicine, her irritability and aggression have reduced a lot. Along with the medicine, Panchakarma was also given and psychotherapy was also ongoing. So, with this combination of psychotherapy, Panchakarma and medicine, overall my child is much better now. She's much better than before. In Ayurveda, we feel that Dr. Narang Sharma is a very good doctor, especially for autism. Thank you.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.
Autism is a temporary phase in the life of a child if treated timely.
Patient name, Vivan, age, 4.5 years old, disease, autism. Chief complaints, speech delay, less understanding ability, inexpressive, sensory issues, lack of focus.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on 27th November 2022 at 11:00 a.m. and felt the scope of treatment to work for the child. The chief complaints were speech delay, unable to write and sensory issues. The child could not write by himself. He was also not very socially active. Throughout the treatment, significant improvement was seen in the child. He started writing on his own, gave answers and also became active. He started interacting more and gave answers instantly. His focus also saw an improvement. He also participated voluntarily in activities and also excelled academically. Instant responses were also seen within a few months of treatment. With improved attention span, he became quick in recognizing and mind games as well. He was able to interact more with peers, participate in class and also understand things in a better way.
Hi, my name is Priya and my son is about to turn 5 years old, and it's been over a year since I've been taking medicine from Navdeep sir. And I have changed, I have seen immense change in my son. Like when we first came here, he used to say just one word at a time. And ever since we started the medicine, and along with the medicine, he's also been undergoing Shirodhara for more than a year now. And with the continued use of the medicines and everything, there has been a drastic change. Now he can express almost everything, about 99% of his things easily, and that too, he has started making full sentences also. Even academically in class, he is doing superbly awesome. He has scored 80% in his last term, and when he was in nursery, he had just scored 55%, not even 50%. And now, just in term A of junior KG, he has scored 88% marks. Now he has started writing also. Earlier, he used to write by just holding on to things. Even when holding a pencil, his grip wasn't proper. But now he has started writing as well. Plus, the main difference I have noticed from the medicine is the improvement in his sense, the development in his awareness that I wanted to see. Earlier, it didn't matter to him at all if someone was coming or going in the house. He was just operating on commands. Like he has started following my commands. But he wasn't doing anything on his own. But ever since he started taking the medicine, after 3 months, I saw more changes. Over the course of 3 months, the changes came gradually, little by little. Now within a year, there has been a drastic change. Looking at him now, you can't even tell that he had mild autism. Yes, he only had mild autism. But now he has even moved out of the mild autism spectrum. Now only a few minor symptoms remain. And we are still in touch with Navdeep sir. We are still taking the medicines. Whatever guidance he gives, whether it's about diet or his prescribed instruments, we are following that religiously, and I mean it. Along with that, we also teach him healing music so that the child heals internally as well. We are giving the medicines, so I am quite happy with the medicines and the facilities. The doctors are always available, and it's been more than a year now. I get a call from here at least once a week to check whether things are going right. They ask about Vivan, how he is doing, so they are in consistent and supportive touch. The entire dedicated team has been in close communication with me for well over a year now, providing continuous assistance and updates. The essential medicines are consistently arriving here at my location precisely on time, without any delays whatsoever. We reliably receive the delivery of these crucial medications directly at our home, ensuring utmost convenience and accessibility.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.
Autism is a temporary phase in the life of a child if treated timely.
A patient name, Moksh, patient age, 6 years old, disease, autism. A chief complaints, hyperactivity, aggressive behavior, speech delay, deficit eye contact, lack of attention. A history of patient. Moksh's parents consulted Dr. Navdeep Sharma for his autism treatment. They discussed about the chief complaints. They started the treatment after being convinced for the same. Interacting with Moksh was challenging as he had difficulty understanding and rarely engaged with those around him. Moksh struggled with speech delay and often seemed lost in his own world. His hyperactivity and irritative behavior made it hard for him to connect with others. After treatment from ND Care by Dr. Navdeep Sharma, Moksh has started using words to express himself, and his speech has improved significantly. Moksh is now much calmer and more focused. The hyperactivity that once overwhelmed him has reduced, and he's more at ease. We're seeing a new side of him. He's interacting more, engaging with those around him, and forming meaningful connections. His understanding has grown remarkably. He responds better, and everyday moments now feel filled with progress and joy.